Hello, listeners, and welcome to Views on Health. As yet another Monday evening comes by, a pleasure, as always, to have with me back on the program Dr. Thushan Gunaratne, consultant vascular transplant surgeon from the National Hospital of Sri Lanka. I'm sure listeners will recall that we had Dr. Thushan Gunaratne speak on acute arterial thrombosis the last time around. And on the program today, it's managing diabetic foot wound during COVID. We are going through trying times with the pandemic actually wreaking havoc on everybody across the world. And having said that, I'm sure when there are other complications along with COVID, it becomes a double whammy to the patient and certainly to the medical professionals who are dealing with them. Having said that, Doctor, may I ask you to enlighten our listeners on managing diabetic foot wound during COVID?
Thanks, Fatima. Always a pleasure to be at the SLBC studios for your lovely discussions on health. So thanks again. So it's a topic I think I've chosen that we have discussed before. Diabetes is a very common problem in our country. Just to set the burden, we expect around 30 to 40% of the entire population to be having diabetes. And 1/3 of these patients will end up with a diabetic foot ulcer. The situation is grim. Those who have diabetic foot ulcers, around 20% actually end up losing their legs. Despite all the issues with COVID, the bottom line is medical problems in cities like diabetes continuing to be there. And these are diseases that need medical attention, need medical follow-up. There's a lot of difficulty in terms of seeking medical attention, going for clinic follow-ups, and be concerned in having a healthy lifestyle with the lockdowns and everything in terms of looking after yourself. So I thought it was very pertinent to discuss a little bit about diabetic foot wound, and especially in relation to how things have changed with the COVID and what you can do as a patient involved or a relative of a patient involved with a diabetic foot wound, how you can look after it better in the current context.
So, Doctor, now diabetes per se as a non-communicable disease is rampant in Sri Lanka. And of course, it does affect the nerves and then those who are having their problems with their feet are, I think, more prone to other complications as well. Now, this in itself is a problem that has to be dealt with. Now, in the midst of this, if that one of those patients contracts COVID, it's a danger zone from a lay perspective. Medically, you may look at it differently, or you may deal with it in a much more professional, calm way, because that's what you do. We will panic because we don't know what to do, and then especially in the home. And as it is, such a person is hampered in movement in the house.
Absolutely. So a couple of things I think you correctly talked about, two important things here. Anybody who has had diabetes or knows someone with diabetes need to go to these clinics for a diabetic sugar checkups rather. Anybody who has had a diabetic foot wound knows things are even more difficult. You're looking at visiting a consultant or a practice around twice a week, once a week at best, usually about twice a week. And unless those the dressings are done, there's a risk you lose a battle against saving that wound. And COVID just puts everything in a different perspective. You could be infected with COVID, and therefore you'd be bound to isolate yourself for a good 2 weeks. And also the fear factor in going to these clinics, which are very busy, a lot of patients around, a lot of waiting time to see consultants or consultations. Consultants and nurses are at very close quarters with you, and you're at high risk. A lot of people are worried and concerned in seeking medical attention or looking to see a consultant or a doctor to look after their foot wounds during this time. And both of these two factors end up causing problems, because it's very easy to miss worsening of the foot wound, and often we are seeing a lot of patients coming very late once the battle is almost lost, because of the concerns of COVID. I thought I would talk a little bit about what you can do at home, perhaps even to try and make sure you look after your feet as much as possible. A, to prevent your otherwise healthy foot from getting a wound, and B, from how to look after a wound from preventing it from getting any worse. So these are two things I thought I'd talk about today.
So end of the day, doctor, with that situation, how does COVID, I mean, the combination, as I said, is very dire. What does one do in that situation? You are diabetic, and you have your issues, and now you have contracted COVID.
Sure. So I think that puts into a different perspective. I thought I'd probably not go there in terms of how you manage yourselves, how you manage your diabetes when you have COVID. What I thought I'd speak about more today, if that's okay with you, is to talk about, even if you don't have COVID, how you can make sure you look after your foot wound, how you look after your feet, even at home, where we normally would advise a patient to come and see us every week or twice a week to look after the wound, to make sure the wound is heading the right trajectory. But if that's not possible, because of the clinics being cancelled, your home area being under lockdown, or you're forced into isolation because you either have COVID or you would close contact with COVID, or simply because you're worried, what you can do to try and prevent it from getting any worse. So that's the part I thought I'd talk about. It's a bit more familiar to me as well. But like you said, if you do get COVID and you have diabetes, a lot of issues in terms of how you manage your sugars and everything else to it. It's probably a bit beyond what I would be an expert on.
So can we focus then on this situation of the diabetic foot wound in this COVID environment?
Sure. So I think you correctly said a few things in terms of the sugar affecting your nerves, and these patients have basically numbness or neuropathy involved in their feet. They also might find their feet deformed because the shape of the foot is no longer what it should be. We have nice plantar arches, the skin is very supple, it's very moist, there's no skin breakage, and our foots are not at risk. But when you have diabetes, your feet are numb, your skin is hard and thick, there may be what are called callosities, the pressure points have all changed, so you are basically at a higher risk of having a problem. Every person has what's called a protective sensation. If your foot is in one position for too long, you're stepping on a pin or a rock, you will always move your foot away. For diabetics, this is a problem. This loss of protective sensation is a key reason why they get wounds and ulcers. So at home, it's very, very important that you use the right footwear. You cannot stress it more important. A lot of people have shoes they have bought, but they tend to be kept in a cupboard or at the entrance of the house, and they use it to go to the garden or outside. They forget that 70% of your walking happens indoors. And that's the most crucial point in terms of putting your foot at risk. So it's very important you wear your shoes, your appropriate footwear at home. Beyond that, the general foot care advice we give is essentially you look at your feet every single day. And like you correctly said, it affects the nerves, it also affects your eyes. And a lot of these patients with diabetes don't have the best vision. So it's important to have someone at home perhaps to make sure they inspect their legs, somebody to look at the undersurface of the feet, which are not easily visible for us. Look at the part in between the toes, the web spaces, look at the nails, make sure there's nothing obviously abnormal happening. The daily inspection is crucial. You can identify a problem very soon. Another problem is a dry skin. And we're in a very humid country, yet with diabetes, you lose your sweat glands, the function of sweat glands. The skin becomes very dry and scaly, and this puts the patients at a higher risk of having an infection from getting into the system through those cracks. Very important to keep the skin very healthy. and we advise using things like a moisturizing cream, especially the night time before going to sleep. And just to reiterate, it should not be put in between the toe webs. We want the toe webs, the web space as dry as possible. So don't put any cream on those spots, but the rest of the leg, the dorsum of the foot, the top part of the feet, make sure the skin is nicely healthy and moisturized. So the basic stuff that are very important you do at home, especially be concerned during this time, that you look after your feet, you inspect them daily, and you might suddenly find some worrying signs that need medical attention. Picking them up is the most crucial part.
So, doctor, you emphasize, or you're very specific about the patient having footwear all the time, other than when they are bathing or sleeping or whatever, and then not just confine it to outdoors but indoors too, and looking for signs in the feet of any. So what would those signs be?
Yeah. So anything that is out of the ordinary is a worrying sign. And diabetes, you as you're well aware, it affects your immune system, and they don't necessarily give signs and symptoms that you and I might get. If we get a bug in a part of the body, find a lot of pain, it swells up, it's obviously red, becomes very tender, you know there's something wrong there. Diabetics, it's not always very prominent, but there'll be subtle signs. So every night, make sure you have a nice wash of the legs. Make sure the water is lukewarm. Keep the feet for some time, and you pat them dry. Not to rub the skin, to pat them dry. And someone will have to inspect the feet. Like I said, not only the top part, the sole as well. If there is any tenderness that is unusual, that's a worrying sign. Any change in color that looks either slightly too dark or too red, that's a sign that something's wrong. Too dark could be that the blood supply might be compromised for some reason. If it's too red, it's a sign that was called inflammation, and that could be an infection that is slowly starting there. Any swelling that is unusual is a very worrying point. A lot of people have calluses or callosities in pressure points with diabetes. Just see how those are. Any discharge that happens, anything that is too offensive in smell, any discharge that happens, that is something abnormal. Pay very close attention to the nails, especially the side of the nails, where it can embed in the tissue and cause wounds. A lot of people with diabetes have fungal infections in between toe spaces. So be very clear on those things. Look for those things and seek medical attention if those are there. And these are things that can be discussed over the phone even, so you can get treatment without actually visiting a consultant to see these things.
That's something important at this juncture, because if patients have access to their doctors on the phone, because they cannot get about sometimes, like you quite rightly said a while ago, it could be that the area is under lockdown or you're in isolation because you have had somebody in the house who's affected with COVID, or as you said, the clinics may be closed for various reasons, and the patient is unable to physically meet up with his or her doctor. In that situation, access via phone is very useful. So everybody, I think, can make a note of it, our listeners, that you need to speak to your doctor and set up this process of being able to contact your doctor via phone.
I think most of us have now realized there's time when a lot of hesitancy in giving contact details for patients, because it sometimes becomes a burden when we're in the middle of something important like surgery. But I think we've realized more and more now the importance of having that communication, and it also strengthens the relationship we have with the patient. And in the current context of the COVID pandemic, I think it's very important, especially with social media being so common now, to have that facility. This is something you discuss with your primary physician or your surgeon, in terms of even something simple like sending a blood report to make sure you're on the right track, or sending a picture of the wound or the foot if there's something worrying. So you can perhaps try and avoid an unnecessary visit. And most consultants are now actually quite proactive and very progressive in the thoughts about this. Some places also have an option of video consultation, which can also be done. So I think we are moving through adaptation in the right direction that these options are available. So I'm part of the National Hospital to the University of Colombo, and we are in the process of developing an app-based system. So patients with diabetic foot wounds can actually manage their own wounds and discuss and send pictures via the app to consultants. So it's something interesting is happening despite all the grimness of the situation in terms of a new era of healthcare. So in terms of diabetic foot wound, essentially you look after these things, and like you said, discuss with your surgeon or the wound care practitioner to see if an option of remote management can be done.
Doctor, I'd like to get back to my question a while ago, rather that in case such a patient is also COVID positive, how does he or she get about it?
Sure. So let's think of a scenario, a patient with a diabetic foot wound and now is COVID positive and therefore is no longer able to visit a consultant or practice. You may be at a hospital which doesn't have a specialist in wound care. You may be at home. So just a little bit about an ulcer. I always say this: every wound heals on its own. We as the surgeons involved in wound care, we don't actually heal the wound. The wound heals. What we do is we set the right environment for that wound to heal. So we look at things in terms of the perfusion, infection and pressure, or the VIP, the vascularity, infection and pressure. These three things are essential to be controlled for the wound to heal. Obviously, vascularity is not something you can do at home. If the blood supply is compromised, you need to seek medical attention. So unfortunately, that is not something you can manage at home. However, looking at infection and preventing infection, making sure the pressure is managed off the wound is very important. These are things you can do at home even without a physician being there with you. So if you're on antibiotics, make sure you take the right antibiotics. If you're being asked to keep the foot off the ground, make sure the wound is not touching the bed and you're wearing the appropriate footwear, you make sure you do all those things to the word or to the letter, so that you make sure that you're doing everything possible to make sure you don't do anything detrimental to the wound. We look at wounds often because sometimes wounds get a discharge, and if that discharge is there for too long, the skin starts to get macerated, and those dressings have to be changed. So if you notice that the wound is getting too much, or the dressings are soaked, there's too much of wound fluid coming out, you need to change those dressings. Even to do it at home, take it off, have a good shower, use whatever you have is fine. Don't keep the dressings on for too long. Even a maximum time for a wound dressing would be 1 week. Anything beyond a week is too long. So if you're at home, you can't do anything, take the dressing off, have a good shower, wash with tap water if it comes with it is fine. Put whatever dressings you have, keep it clean. Try and send a picture of the wound. Do the dressings to your consultant, and he might be able to advise you on other things. So those are the basic things I would tell in terms of a person who's unfortunately having a diabetic foot wound and unable to visit a practitioner to be sure to look after the wound.
Doctor, from a lay perspective, when we have a wound, we tend not to wet it. Now you're saying wash it. You've been saying this, and I understand. How does that work?
So the dressings usually we put are kept on for a few days. And in the practice, we use dressings that have a lot of properties in terms of helping the wound to heal. For example, with antibacterial properties, some dressings have the ability to absorb the excess water. So we keep these dressings for a few days. That can vary from about 3 days to about 7 days. Is usually not anything beyond 7 days. But when you are scheduled for your next wound dressing or visit, to change the dressing is important. You take the dressing off and wash it thoroughly. Just let it run under tap water is fine. What I meant was, if you're stuck at home and you have not been able to get your dressings done, do not just keep your dressings for 2 weeks, for example, because it will only make the foot wound worse. So if you're at home, you're stuck at home, you can't visit someone, if it's been about 5 to 7 days, take the dressing off, wash it with tap water, if that's what you have, and then you put whatever dressings you have.
provided you wipe it dry.
Yes, so just pat it dry. If you are able to access something like a gauze or some Vaseline, or you have some basic ointments you can use, and each consultant will have their own preferences for this. Some patients will already have some dressings with them at home. You can cut a piece, keep it on the wound, and put a moist dressing, not too tight. Use a bandage rather than the gauze strapping, and again, just stick to the principles of keeping the pressure of the wound, which would be using the appropriate footwear, making sure that lying on the bed, that the heel or the wound doesn't touch the ground too often, and you minimize the amount of walking you have to do.
So, doctor, such a patient is diabetic. Right. The foot being affected is one aspect of it.
Yep.
So, therefore, that patient is under medication from the physician. Now, if back again COVID sets in, that's a viral situation you're facing. How does the two, I mean, for the COVID, as we know from what we have been told, there is no medication as in medication, but there are certain sort of types of vitamins and immunity boosting medication that is administered. So that and the diabetic issue, the medication for the diabetes, have to go hand in hand.
Yes, absolutely. There's also a component of lifestyle in all of this. A lot of non-pharmacological aspects of things that are important for a person with diabetes. Before COVID was there, any diabetic would have been eating the best nutrient food. A lot of vegetables, for example, have access to all the types of food. They probably go for a walk twice a day, in the morning and in the afternoon. They'd be doing stuff to keep themselves healthy. So COVID-1, they caused a lot of issues in terms of the lifestyle, the food that they eat, the activity they had, the lifestyle they had has changed. A lot of stress gets involved, and these all have effect on the blood sugar control. The vitamins and drugs are unlikely to cause a lot of interactions with your blood sugar. If somebody was given steroids, which is not very commonly used, it can cause issues. A lot of subject in terms of what medicine some people might use with COVID, but it's always important to tell the physician that you have diabetes and to make sure that's been looked into. Home monitoring of blood sugar is very important, and if you have access to a glucometer, that is very crucial. And again, you could have the linkage with your endocrinologist or the physician to make sure the blood sugars are being discussed in terms of how you should titrate your medicine. And even at home, even during lockdown, try and do your walks and your exercise. Keep yourself active and healthy. It's all very important. Like you said, diabetes is a systemic problem. It affects the entire body. And until the diabetes is controlled, treating the wound alone will not suffice.
So exercise is essential within the house.
Yes, so obviously with the ulcer that might make things difficult. However, keeping yourself active in whatever form is very important. That you do the normal things you did, because your blood sugar will be controlled at that level based on the lifestyle you had. And COVID may significantly affect the lifestyle you have now.
Thank you, Doctor. Your take-home message.
So we are in a difficult time in terms of the COVID pandemic, more so because patients with diabetic foot ulcers are unable to visit their clinicians or their wound care practice. However, there are things that we discussed which hopefully can take home in your mind to ensure you do look after your feet and make sure you use the footwear at home if you have non-ulcerated diabetic feet to prevent from getting an ulcer. If you do have an ulcer, like we said before, have a chat with the physician, try and form a mechanism of trying remote monitoring the patient as much as we can, avoid contact with the public as much as we can these days, and stick to the healthy things and look after your feet.
Thank you so much, Doctor. Truly appreciate your professional input on the program, Views on Health, and managing diabetic foot wound during COVID was a topic that Dr. Thushan Gunaratne, consultant vascular surgeon from the National Hospital of Sri Lanka, discussed on the program today. Thank you so much to you, Doctor. Truly appreciate it, and we're grateful to you.
You're welcome. Thanks a lot.
Thank you to Tarindu Disanayaka for technical assistance. I'm Fatima Razi saying good night, and looking forward to your company next week, same time on Views on Health.